Hello all, this is Mrs.Lalithamani, professor from SNS College of Nursing. In this lecture series, we were learning about the topic renal transplantation. We have seen so far what are the facts, what is an organ donation, how this organ donation is happening, and what was the facts about this donation, what are the types of donors, and which organs all can be transplanted. Everything we were learning about in the previous two slides. In slides including the lecture series. So here when we talk about a renal transplantation, we need to know, or we need to convince the patient and the attenders that instead of risk, though there are risk, the benefits or the survival is important in case of renal failure patients. So the risk includes acute rejection or failure that is less than current methodologies. Anti-rejection medication effects might be there, infection, some malignancies, even cancer, example skin cancer can happen, increased risk of diabetes, high blood pressure and high cholesterol. So these patients anti-rejection medication effect, infection, some malignancies, example skin cancer can happen. Then compatibility, we need to find out whether the patient has to be ABO compatible, and this donor recipient should share as many as HLA antigens and minor antigens as possible. The immunosuppressant drugs are given to the prevent antibody antigen reactions. So we know there should not be any problem that happen with the recipient's body defense mechanism. So we need to reduce the action of the cells. Immunosuppressants can be given. So the recipient selection, how a recipient can be selected. So everybody might think that one or the other day somebody has to be a donor. So there are very few contraindications where the general medical conditions which will pose the risk for the donor himself, and cardiovascular screening, that is diabetic, hypertensive, or the patient is having some coronary artery vascular issues. The cardiovascular screening has to be done, and the recipient selection should be based on this concept. Age appropriate and routine cancer checkup, and infection or HIV, hepatitis, tuberculosis, presence performed and antibody, the PRA, presence persons performed antibody. So while preparing donor and recipient for a kidney transplant, we need to consider that the blood group matching, tissue type matching and cross matching. Blood group matching, tissue type matching and cross matching. It implies to a living kidney donation and deceased kidney donation. The cross matching will be considered for a living kidney donation and decreased kidney donation. So when there is a blood group matching and tissue type matching, it will tell us whether the patients will be able to tolerate the organ which is being transplanted. The next one will be preparing donor and recipient site for a kidney transplant. Donor and recipients matching can be done. So in this case, when the preoperative care includes provide routine preoperative care, assess knowledge and feelings about the procedure, assist in or address concerns, reducing preoperative anxiety, continue the dialysis when it is needed, either it may be temporary or it may be permanent, administer suppressive drugs to ordered before surgery. It can help in the prognosis, made the graft rejection. So in this case, we need to find out whether there is any graft rejection or antigen antibody reaction which will be causing an immunosuppressive action side effect. So when we talk about this preoperative care, we need to think about the postoperative care, where the post-op care includes providing routine postoperative care, maintaining urinary catheter and maintaining the urinary catheter patency, measure the urine output every 30 to 60 minutes. Initially, oliguria is early sign of acute bladder necrosis. So when we think that the acute tubular necrosis, we need to think that there is a output. If it is less than 30 to 60 minutes, then we have to consider monitor the vital signs, maintain IV fluids, and it helps to maintain the vascular volume and tissue perfusion. Also, we need to administer diuretics. So measure the urine output every 30 to 60 minutes. Initially, that is oliguria is a early sign of acute tubular necrosis. So we need to find out which is the pre-operative care, which is a post-operative care, and what care has to be given for a patient who is coming with the complaints of what is this condition. So in this renal transplant, so when we try to conclude, the kidney transplant saves lives, improves the quality of life, and it also saves the cost. Until rather than this saving life then saves the cost, we need to think that it is very important for a person or a family member to encourage the other people to go in for a renal transplant. So until then, we have seen so many topics which were the content of library. I will tell about the renal transplant. So until then, we need to sign off and catch you later in the upcoming lecture series. We thought something we can do, but we have taken an more interesting topic, renal transplant.